Great, thank you. So thanks ever so much for inviting me here today. And I'm going to talk a little bit about my kind of experience within sort of participatory health research and co-production. And so I'll kind of go through what I'm going to talk about, but maybe just a way of introduction. So I started my PhD in 2007 and kind of came across the words of co-production and co-creation kind of 2008. I was really looking at how service users, people who use the services and frontline staff can change public services from the ground up. So rather than sort of top-down policy, people who use services are often the ones who know how to change them. So that was kind of my core interest. And then I kind of came across these words of co-production and co-creation. But I was also interested in the histories of welfare service user participation and also employee participation. So just a quick overview of what I'm going to discuss today. We've already had some kind of discussion of different principles and definitions. Why would you want to co-create? We want to think about who's involved and when, and Michael was already sort of talking about that and people being involved all the way through a research process. I'm then going to talk a little bit about power and the power relations that come up through these processes, and then also things like knowledge, methods, intellectual property. Some of these kind of participatory research methods do challenge the kind of traditional way of doing things. So that's I'm going to be exploring that as well. Okay. So a little bit on definitions. So looking at the different, sometimes these are used kind of one over the other. Actually, sort of they all come from different disciplinary backgrounds. So the thing that joins everything is this kind of prefix of co. So that's something that's actually together. We're doing this jointly and we're doing it mutually. So that might be kind of co-creation. So this is where kind of end users can be co-creators who've kind of experienced value and innovation. Co-production, this comes from work of Eleanor Ostrom, looking at how citizens are actually involved in producing the public services that are important to them. And then also co-design, coming from the discipline of design, using participatory design methods to involve different people to create better services for people. And again, sort of looking at what's shared amongst these different concepts. There's things around the sharing of power. So particularly I've probably got my most knowledge is around the kind of the literature around co-production. And this is something that's often comes up as key within co-production literature. How do we work together in more equal relationships through either if you're kind of improving a service, how do you make sure that everybody's involved in that, or within a research process, then how do you actually involve people in the data collection or the data analysis and so on. Including everybody's perspective skills, building on people's assets. Actually, everybody benefits from working together. So there's a sense that we're all doing this and getting something out of it. And then things around blurring roles might be important if you're involving people in different ways, but having clarity of what people's roles and responsibilities are. So who would you want to involve when you're getting involved in sort of setting up a process of co-production or co-creation, and why would you want to do that? So within the co-production literature, there's a kind of there's some interesting kind of debates over this whole idea about service users, and so one of the things that I'm kind of quite keen on kind of exploring is this idea of actually members of the public, people who are not paid by an organisation, but they might be service users, they might be activists, they might have been a patient within a health service. How do we involve these people, because it's very different if you're coming in as a member of the public as you would because you don't have that institutional background. So you're not necessarily paid by an organisation, you don't have access to the same resources that an organisation has, but we all have multiple identities as well. And so someone might be, you might be in one situation, you might be going to your doctors or a hospital, in which case you're very much kind of the service user, but then also you might have a professional background as well. And then I won't go too much into this, but kind of there's also an interesting thing in terms of the disciplinary roots of some of these concepts, and whether things are coming from the private sector or public sector. How is the public sector different? And then there's quite a lot in kind of public management literature around that area. I won't go into that in depth now. So when you're thinking about setting up your own project for all the people who are sort of starting on this process within Health Cascade, really want to think about, well, who's actually important for your project? Do you want to use the same group of people for the whole project, or do you want to be involving different people at different times? Who are the health professionals who you want to be involving? If you want to make changes in a system, actually you need to be involving those people who have the power to make those decisions, to be able to change things. You might want to be involving community organisations. This might be particularly important if people are underrepresented within a particular service. So thinking around issues of inclusion, diversity are really important. But nobody is going to represent a whole group. So if you're involving a few people, you've also got to think a little bit wider than that, because there's this issue that if you're just, there's a kind of balance between involving enough people, because, and then it might get really big, but actually not, one person isn't going to represent everyone. So there's kind of some dynamics there. And actually, if you're involving people who have not been involved in the past so much, actually the system might have let people down, and there might be a kind of lack of trust. So there's some issues there to kind of think through how you might manage that. So what's the purpose? The whole kind of field of co-production can take more time and energy, because you are involving more people and you want to make sure that they're getting a good experience as well. Thinking through, why is this the right approach for your own project? It's really important. So some of the political might be political benefits around social justice, democracy, people, including people who have been marginalized before. Personal aspects, people might feel much more empowered to actually be taking part of this. And then this whole thing about actually producing better or different knowledge that actually takes account of context. Okay, so going on to kind of issues around power. Power is often, that this whole issue around power is spoken about a lot in the literature, but it can be quite difficult to know, where is it? How do we actually see this? So the other thing I've been kind of really exploring is the sociological theories of power, and actually looking at how this can help us understand the dynamics within a co-creation or co-production process. So power, once you start looking at it, it can affect absolutely everything in relation to our aims, our objectives, how we see the world, who's involved, how we connect, what language we use, how we work within and across organisations. Different organisations have different ways of doing things. And then also the outcomes and changes we make through the project. What outcomes are important to whom? And that's something that you kind of want to be thinking through as well. I won't go into this too much, but kind of there's different ways you can actually see power. So this might be kind of more visible things like rules, decision making, conflict, or it might be a sort of assumptions and values. And so thinking through, kind of having kind of reflective practice through a process is really important, and something that's always worth thinking about. And I think we use one of these questions for our sort of later discussion through the morning. It's actually what are the assumptions that we bring to the table, and what normal ways do we think we don't even realize we're doing it, but actually how can these kind of might prevent some of the principles of co-production being enacted. So I like this quote by Van Gogh, because I think it sort of sums up, we're trying to achieve, the principles are are lofty, they're high, and if we're really actually achieving them, if we reflect deeply in ourselves and go, okay, there's always something that you might be able to do better. So I think it's something that there's not always a clear answer, and we're always learning from each other, and actually that's part of the philosophy of the process. So I'm always learning how to do this work. So examples of useful practice, thinking about payment for people who aren't involved, who aren't getting involved as part of an institutional role, who aren't a member of staff. Clear roles, expectations, making sure everybody has a voice. How you manage the different voices and encouraging people who might not normally want to take part, thinking of different ways that you can get people's perspectives and thoughts. Having a clear process for managing decision making and disagreements is really important, because if you're involving lots of people from different organisations and different perspectives, chances are people will disagree. So you kind of think, well, how do we actually sort through this process? Having good information sharing, keeping everybody up to date, and giving people feedback. So a few resources just to sort of support you along the way. This is one of a group of us kind of did some interdisciplinary work around kind of how different disciplines use these words and use co-produced research, and we brought together this is some reflective questions to support you to think through what you're doing and when you're doing it through the process of the research. Oh, sorry, I'm going backwards rather than forwards here. So we spoke a little bit about knowledge, methods, again, huge areas, which I have no time to go into, but just a kind of key point around kind of interested in I work within medical school, and so you've very much got the dominance of the randomized controlled trials. I'm aware of one co-produced randomized controlled trial, Steve Gillard's work, but yeah, then there might be more coming on through at the moment, but it's quite a different in comparison with like community-based participatory health research, that there's different paradigms of research, and there's this point about how we value different types of knowledge, and the issues of kind of evidence hierarchies within universities. And then the very practical questions of how you facilitate this when you're working with a group of people, combining the expert knowledge of practitioners, research evidence, and then lived experience. So if you're going to be doing this through a research process, how do you combine all those different types of knowledge into a decision-making process? And then you also have the university systems around terminology used in intellectual property contracts. Those are some of the issues that kind of institutionally also aren't necessarily used to this way of working. So other challenges and other resources that might help. So we've got within the UK, the National Institute for Health Research are doing some work around kind of procedures around payment for public contributors. They've got a great resources website, which the link there for things around kind of health inequalities, structural inequities, how we actually change institutions as well. So I won't go too much into this just in terms of time, but please do share the slides afterwards, and there's various links here that can help people kind of navigate various of these challenges. We've also done, a map of resources. So this is for people, again, this was the interdisciplinary project I was talking about, where we're trying to bring together all the lessons that people who have been through these processes, and there's lots of toolkits and things out there to help people. So we've tried to map that and kind of produce lots of links for people to be able to develop. And then just a few sort of things for people to think about for the discussion later on around kind of what are the assumptions and normal ways of doing things that people might prevent some of these principles, and then also the kind of the practical issues. What can you foresee coming up against if you're at the planning stage, and what challenges can you predict? And then I've just kind of produced all the references here that I've used so that people can have a look at these later. And just to say thank you very much to everyone who I've worked with over the years, because I've learned so much from everyone, and it's always a constant learning process, this work. So thank you.